Hello, I'm Dr. Tim Shaver from Arthritis Rheumatology Clinics of Kansas. Today I'm going to visit with you about a group of diseases that is not very well recognized oftentimes, not very well known from many people, but it falls under the heading of what we call seronegative spondyloarthritis or spondyloarthropathy, which is a mouthful. But this includes some disorders that are very common, and the most common things we see are a disease known as ankylosing spondylitis, one known as reactive arthritis, and one many of you have heard of because of the TV commercials, known as psoriatic arthritis. So we'll talk about those briefly separately. First of all, ankylosing spondylitis is a condition that affects about 0.5% of the US population. It's a little more common in males, about 2 to 1, 3 to 1 in males. And it is a condition that involves spinal inflammation, which is something that unifies all of these disorders. It starts in the sacroiliac joint. It starts at a young age, usually 20s and 30s, and it can result in some people, in severe cases, in fusion of the vertebrae together. So it can cause a lot of disability and a lot of discomfort, and it's something we can treat with specific medications. It is very underdiagnosed, but people who have back pain associated with morning stiffness, nocturnal awakening, things like this can have a condition known as ankylosing spondylitis. It can be diagnosed by examination and by x-ray of the pelvis looking at the sacroiliac joints. Reactive arthritis occurs in response to infectious illnesses, the most common being certain types of gut infections and sexually transmitted diseases, but also infrequently after a streptococcal infection like a strep throat infection. And this can also result in sacroiliac inflammation, usually only on one side or the other, which is a little different from ankylosing spondylitis. And you can also get more inflammation in other joints, usually the joints below the waist, like knees, ankles, heels, areas like this. And this may run a self-limiting course. It may only last about 6 months as far as the active phase is concerned. It is treated also with specific medications that can help reduce the symptoms and at least level out the inflammation quite a bit. And then finally, psoriatic arthritis. Psoriatic arthritis is something that has a highly variable presentation. It can begin it's more common in other joint groups like the hands and feet. You can see it almost in any size joint you're talking about. It can involve the knees, the hips, the shoulders. It can involve quite a bit of joint destruction in some individuals. And what happens is most of these individuals have had psoriasis for quite some time. Some of them, the psoriasis and the arthritis begins together. Some, the arthritis begins first, and that's a small minority of people. This is something we can treat also with specific medications that will help reduce the inflammation and prevent the damage. And those medications can mostly also address the skin disease. And this is also lumps into this category because you can have involvement of the spine, the sacroiliac joints. All three of these disorders have spinal involvement as a potential complication, pretty much universally in ankylosing spondylitis, less commonly in psoriatic. We also tend to see inflammation at attachments of tendons and ligaments into the bone, and that's another very specific thing we run into. We see a lot of tendonitis and bursitis. So these are conditions that can be diagnosed under the care of a rheumatologist, and they're often very challenging to diagnose, but we are very interested here in identifying them and making sure we treat them adequately. And so if you entrust your care to us, we promise we will do our best to give you the ideal treatment for these disorders and diagnose them if present. Thank you.